So let me introduce myself. I'm Dr. Pragya Mishra Choudhary. I'm a consultant obstetrician and gynecologist and infertility specialist based in Patna, which is the capital of Bihar. I would say that the most important causes for maternal mortality in Bihar are maternal sepsis, anemia, postpartum hemorrhage. The reason is that anemia over here, it starts in infancy, continues throughout adolescence and teenage, and then even when mothers young when they become young mothers. So it is not detected and it just gets worsened until the time when she's actually when she's expecting. And that is the time when when somebody's anemic, then she's more prone to antepartum hemorrhage, postpartum hemorrhage. So PPH, postpartum hemorrhage, is again another very important cause of maternal mortality. And that, of course, it's not only because they are anemic to start with. Of course, nevertheless, it is the most important cause. But the problem is that the availability of blood, freely available and available to all, and sometimes the cost factor also can become a big problem, and accessibility, feasibility, and they all add up to this maternal mortality. I mean, anemia being a cause of maternal mortality. Another very important cause is maternal sepsis, because it's quite in our country, termination of pregnancy, that again is a very because of unsafe abortions, which you don't have in the Western countries, but still in India we have millions and millions of unsafe abortions. So that again leads to maternal sepsis and becomes a very important cause of maternal death. And even at the time of birth, when she's about to deliver, then maternal sepsis, if it doesn't get treated very fast, then it can kill women. And sometimes the antibiotics, even when prescribed, they are so costly that everybody is unable to afford it. So all that so ultimately, so maternal sepsis is a very important cause of maternal mortality in Bihar. Well, coming to the challenges, like in Bihar especially, I would say that accessibility, accessibility of health to all the women. Like, because only about, because almost 70% of the women are residing in the villages. So to them, it is not, healthcare is not that freely accessible. Sometimes, like when she's almost dying, then, she has to be transferred from the periphery to say, to a tertiary level care center, which is, say, Patna or to any of the medical colleges in Bihar. So transport is not, its transport system is not very good. Because sometimes she has to travel from the remote areas of Bihar, and because of that there's not enough time, and like say her condition deteriorates, and because of that and that I think is a big challenge from this transport problem, and thereby being accessible to the health care system. So that is a big issue. Then the cost factor as well. Because all the you have tertiary level centers which are of the private setup. So and you have medical colleges as well. Sometimes medical colleges are not well equipped, or they don't have all the facilities that which like say when a woman really needs it, it is available for her. So then she needs she turns up into the private sector, and then in the private, the problem is the cost. Again, when they come from rural areas, she's quite, it becomes quite difficult for them to really, afford the high, quality services, even if it is available. So I think, really, if you ask me, then, I think this transport problem and cost is a big challenge. And secondly, one more thing is that, what I feel in my day-to-day practice is that because of the education level, because it is not very good in Bihar. I'm talking about the majority of women, who come to us. It's very difficult to make them understand things. They don't realize the gravity of the situation, and the seriousness, how serious is her condition. And sometimes if the woman understands, her near kith and kin who are actually going to pay for her treatment, they don't understand. So I think that problem does, we do have to face that problem because of the poor education level of the women. And another thing is that because of, certain isolated episodes here and there, related to doctors, basically what is happening that, patients are actually losing faith in the doctor community. Which so I think it's very important for the whole doctor community, fraternity as a whole, how to actually sort of start building up that you're getting back that faith from the from the patients, to imbibe that faith in yourself, so that they actually start believing that what you're saying is actually necessary and important for her. So I think these are some of the challenges that we face. India is a big country, and you can understand, so densely populated, and government is striving hard, to basically to initiate and to implement health policies, and especially, it is focusing towards the peripheral areas of like I think most of the states. In fact, the government has been really striving hard, and it has gone a long way in institutionalizing deliveries. Like almost a decade back, the people used to have almost thousands and thousands, or I could say lakhs and lakhs of home deliveries. But now government, because of its efforts and its policies, majority of the women are actually coming to institutions for deliveries. So, and especially that's what I have seen in Bihar. And that has actually gone to quite an extent, in curbing maternal mortality, I must say. And governments in order to prevent after postpartum hemorrhage and shock, does come up with these anti-shock garments, at least till the time the patient from the time that she takes to arrive from the periphery to the tertiary level care. I mean, this is being actually made available in the primary health care centers also. So to quite an extent, I think government has done, and it has gone quite a long way. But then I still think that loads still has to be done, I think, as far as health is concerned. I mean, especially I would say that, cervical cancer, it is a very most important killer of, women. I mean, coming to women cancers, it's the most important cause. And I feel that there is one place where government is lacking. Like if you see the Western countries where they all have an organized, structured screening program. For instance, in the UK, they have been able to bring down the incidence of cervical cancer by almost 80% because of this organized structural screening program. But when you come to India, and especially in some of the northern states of India, what happens, we don't have an organized structured screening program. Whoever comes to the gynecologist, say, gets opportunistically screened for that disease. So I think I really feel that government should do something about the screening of cervical cancer. Well, I think technology again, I think has grown by leaps and bounds. If you see, even when we come to ultrasound in gynecology, which is a very important part of diagnosis, now we have 3D and 4D, which really helps in the detection of congenital malformations. And sometimes we can even avoid doing prenatal invasive techniques because of this 3D and 4D ultrasound scans. And you have MRI, which really helps in the in detection of advanced say uterine or cervical cancers. And even when you come to infertility treatment, a lot of things like, I mean, we have all the important things that you have in other states, or even say in Mumbai and Delhi. We have like, ICSI machines and IMSI machines. So the infertility treatment also, because of technology, has really become quite advanced in Bihar. So, but the problem here is that is it affordable to everybody, or to what percentage, of the, or to what section of the women folk in Bihar is it available? I mean, if it is available in all the government hospitals, then it is a different thing. It would be available to everybody. But most of this is not presently available in the government setup. So ultimately what happens that these women have to, actually lay their shoulders, or, really they have to come to the private sector. And then again, this cost problem is paramount when they come to the private sector. So, I would say that yes, Bihar is not lagging behind as far as technology is concerned. We have, we have all the important, I mean, all the latest technology and gadgets, especially in gynecology, available, but of course not really available to everybody. That is the most, that is the biggest hurdle, I would say. I would say that relatively, I wouldn't say that, just like, in other states where you have a mushrooming of IVF clinics, like in Delhi and in Kolkata and in Mumbai. I won't say that we have mushrooming, but we do have, like, say, about, a dozen IVF centers all over Bihar, about half a dozen in Patna, and the remaining half a dozen scattered all over in the peripheral areas of Bihar. And we are sort of, to be very honest, I would say that we are catching up, on as far as IVF is concerned. I mean, I wouldn't say that it is absolutely, comparable to the treatment that you can get in Mumbai and all, but relatively, it is like getting advanced, and we are sort of, and more women are also coming up because of, they are becoming aware that, of course, something like IVF is available, and which, they can actually resort to. So I think it is becoming popular, and I would still say that, we have to still a long way to go in actually increasing our standards, as far as, IVF and infertility treatment is concerned. Now again, basically, as you must have heard about this, ART bill, but of course it has not been passed by Parliament at present, and at present there's a lot of opposition to some of the things in the ART bill, which is being actually opposed or challenged by the doctors at present. And so as far as I mean, unless and until the ART bill is actually passed, in that only then we could say that that it would be really regulated, this I mean, it would be regulated, or the centers would be regulated as far as ART practice is concerned. So we really have to wait, till the time comes when this bill is actually being passed by the Parliament. Basically, surrogacy in India, why the women who actually act as surrogate mothers. Now, it's mainly because of money. You know that poverty is rampant in India. And who are the women who are actually, coming forward to become surrogate? They're actually coming up. They want to become surrogate mothers because they are in real need of money. So sometimes I feel that whereas in the Western world it is not like this. I think what I feel that in the Western world it's because they just maybe they just come forward sort of to help women who are unable to become mothers because of the problems with the uterus, which is the end organ. Whereas in India, sometimes I feel that because of surrogacy, we are actually, I just feel that, we are exploiting women because they are poor. That is my personal opinion. Of course, it makes a lot of women happy because they don't have any choice and then they can become mothers. But when you come down to that it's basically the poverty thing which is actually driving some women who are really poor just for money. So them they come forward and actually then they want to become surrogate mothers. So from that point of view, I feel it's a sad scene in India, this surrogacy thing. And one more thing, I would feel that why, we have so many, I think millions and millions of children in India who are orphans. So why not actually promote or sort of encourage adoption? Rather than actually telling them because basically they are not actually carrying the baby. And if you think about it, what is the pride or the joy of being of womanhood? That is when you're actually yourself carrying the baby. Whereas what happens that these surrogate mothers, okay, I mean the women who actually cannot become mothers themselves, okay, fine, the eggs and the sperms are of the genetic parents, but actually nurturing the baby, they don't actually get the joyhood of nurturing the baby. So that way, why not actually, if you think about it, why not, I mean, that's just a thought, for the day. Like, why not actually encourage adoption rather than surrogacy? Because I just feel that, that there's a lot of exploitation, when it comes to surrogacy.